It's kind of what you just have to deal with living in Troup County, but it's not okay. And we are actually closer to Valley, Alabama than we are to any medical care that I need, especially during my pregnancy. Troup County has a very low access to maternal care. Maternal post care is even starting to affect when it comes to our pediatricians. Being in West Point, we don't have any OBGYNs here. So my primary care OBGYN is actually also in LaGrange. That is about a 20 to 25 minute drive for us. And it's kind of nerve-wracking to the point where I've actually spoke to my doctor about being induced. That way I don't have to worry about that drive and pain or fear that something's going wrong.
We are the closest hospital for about 4 counties in this area. So not only do we serve Troup, but we also serve Meriwether, Coweta, Harris, and Heard counties. Statistically, we know that women who have to travel further for care are at a much higher risk for adverse perinatal outcomes. I'd say probably about 70% of my population of pregnant people are high risk.
20-25 minutes that's an extensive drive in an emergency. And even if you're looking at waiting on an ambulance, that's 10-15 minutes to get here, another 20-25 minutes to get to the emergency room.
We're thinking about how far away someone is from a hospital. You have to think about their access to urgent care. And in these small rural areas where people live, and there are hospitals that are not equipped to take care of obstetric patients, then that can really be a serious problem.
To people in low access areas, it's a struggle. And if you're not in that struggle, then you don't understand. Not everyone has that same equal medical care, that same equal accessibility. We can have the same doctor, but we don't have the same journey to get to this doctor.
We've seen this landscape change over the past 30 years in terms of labor and delivery units and OBGYNs available in hospitals across the state of Georgia. We've had at least 35 closings over the past 35 years of labor and delivery units. You end up having whole communities and whole swaths of areas that don't have an OBGYN provider at all.